Good afternoon, everyone, and thank you for joining. My name is Brian Debian. I'm with the Training and Optimization team. And today we're going to be discussing orders and charges. Well, really, we're going to be discussing order setup in terms of going through the basic steps and the fundamentals to setting up orders and charges. And we'll also be going into some of the using characteristics in orders and charges. For those of you that have signed in, thank you for taking time out of your day for joining this session. We will be together for the next 2 hours to basically go over the setup, which is what we're going to touch on first, and then we'll go into the using portion once we're done with that piece. Okay, again, my name is Brian Debian. I'm the Senior System Optimization Analyst for the Health Solutions team. And as I mentioned, this training should take no more than 2 hours. And again, I'll leave some time up until then, up until that 2-hour point, so we can answer some questions. So just remember, you all are muted. I cannot hear you. And if you do happen to send me a hand raise or a chat, the challenge with that is I will not be able to monitor that until the session is actually ended. And I will be posting a poll towards the end so you can provide me with some feedback in terms of how well the presentation was. So thank you again for joining. So you should actually see the orders and charges screen. That's exactly what you should be seeing in terms of what you're actually looking at in orders and charges. So I have already logged into Intergy, and I do have some windows opened up at the bottom because the setup does take place in 3 different areas when we talk about setting up orders and charges. So the reason why I'm starting here is because this is basically what this course is all about, setting up orders and charges. And as you can see, we're already inside of a database, which is our training database, that already has some tabs along almost the top portion of your screen, starting with Predictive Order Management. And then you'll see tabs such as Floor Stock Meds, In-House Labs, so forth and so on. We're going to go through the steps on how to set up those tabs. And inside of those tabs, learn how to set up the various subtypes and the actual order types that you see in blue, the actual links. Now, there are some default handling customizations that we could also apply to each of these subtypes in the event that you want to make sure that folks are capturing results before they close the orders, perhaps capture a service code or what we know as a charge whenever we're using orders and charges. So we are going to go through those various steps so you kind of get a better understanding of how to maintain orders and charges, how to set up orders and charges, how to deactivate certain tabs, and clean it up, if you will, when we talk about order setup. So we'll cover all of that stuff before we get into the actual basics in terms of using orders and charges. So there are some things that you do need to be familiar with, and that's where to go to set up orders and charges. As I mentioned earlier, there's 3 main areas. And the reason why there's 3 main areas is because you got your basic order setup, which is in the EHR. And then you have tasking. And in order for the tasks to appear in orders and charges, you need to have access to POMIS. So you will need to go into setup. You will need access to setup in POMIS to access the task portion setup of the system. And the third place is lab favorites. You will need access to lab information in order to set up the lab favorites. So again, you just need to keep in mind that orders and charges is not set up all in the EHR. Okay, there's 3 areas that you need to go to. Order setup, which is in the EHR, which I'm going to show you in just a moment. Tasking, which is in POMIS setup. And last but not least, lab information. So you will need access to those 3 areas: order setup, tasking, and lab information. So the first step is accessing what I'll go through first is setting up the lab favorites, the tasking. That way, once we get through those 2 portions, we can concentrate on all of the setup that's done in the EHR. Okay? The first section I want to talk about is lab favorites. Okay? As you can see here, there's only really a handful of lab favorites that you see here. Now, the term lab favorites, you're only going to know what lab favorites are if you've been trained on how to maintain lab favorites or use the lab order system, which we call Clinician or Lab Portal Services. As you can see in this Labs tab, you do have the ability to search for certain labs that are in this one gigantic list. This list obviously is not very long, but this is the list where you actually set up all of the core lab orders that are ordered by the practice. This includes all tests that are done through Quest and LabCorp or any other reference lab that you currently contract or work with today. So this allows me to click on a lab order and then create some handling in the background so that the system knows what to do with it, meaning, do I need to send this somewhere to order it, or do I just need to mark it as ordered, which we'll go through in just a moment. So what I want to show you is how to set up lab favorites in orders and charges. Okay, this means you will need to go to IntergyEHR at the top left, and you will need to access lab information. So again, this is one of the three areas where you set up orders and charges. We're going to discuss labs first, which requires access to lab information. So you're going to click on IntergyEHR. You're going to then click on Tools, and then you're going to go into lab information. Many of you are familiar with lab information because this is the screen that is utilized not only to send out your lab order requisitions and communicate with the lab, but to retrieve lab results. In addition to that, you are probably familiar with this screen if you've entered lab results manually, such as many of the tests that you do today in-house. Where we are going to go is favorites. Okay, so in terms of setting up lab favorites and orders and charges, this is the area that you need to be familiar with. So not only will you need access to utilities and labs information, you need to be familiar with what we're actually going to be putting in here. So every lab that you typically send out, that you order and is sent out to a reference lab, needs to be set up in this list here. Okay, it's one list. Okay, and the only difference between this list of orders, lab orders I should say, is that you cannot create subtypes like we can in the traditional order setup. What I mean by that is as you can see, you can set up a basic metabolic panel like you have here, but I cannot categorize that if I wanted to lump this up, let's say, with a panel. Each lab has to be put in individually, and at the bottom where you see these details is where you could actually put in the description, right? Whether or not results are required, when the results are due, and the default priority, okay? So if we wanted to add a new lab order to lab favorites, what we would do obviously is click on New. And the description is basically up to the practice in terms of how they want this information to look on the lab favorites. If you want to spell out comprehensive metabolic panel, by all means, that's exactly what we can do here. Okay, like such. Now these next fields, I'll go over what these fields exactly mean. However, there are certain fields that you're going to notice throughout the order setup that may not be used, whether it's for a particular recommended purpose or it's just not in use because you may not be serialized for some of the tools that are used by the EHR. Now, in terms of the provider code, this is really only used if this lab is to be used only by a select provider, okay? This is the reason why we're going to skip this field right here. Okay? Now, results required obviously is something that is important, and the reason why is you want the order to be tracked, okay? And that's the way the practice is basically set up, okay? So for order tracking, it's okay just to put P as the practice default, which is what I'm going to do here. And the results due, the recommendation in terms of the results due should go by what the reference lab typically recommends. So for example, if a comprehensive metabolic panel typically takes 3 to 4 days for the result to come back, then you can put 4 days, for example, okay? Just remember, keep in mind that the results due is really there to help the practice determine whether or not results are overdue. So if you leave this, for example, to 1 day, or you put 0 days, what's going to happen is tomorrow, this lab result, if I was to order a CMP right now, this lab result will be overdue as of tomorrow. Well, you don't want to do that, because if we already know, according to the reference lab, that a CMP takes about 3 to 4 days to come back, then you want to make sure that you set it that way. Set the default that way so that you're getting much more accurate information in terms of monitoring outstanding labs. Last but not least, the default priority. This is real simple, okay? When you order a CMP, okay, you can default the priority. So if I default this to 1, this means that this is a high priority lab, okay? So the decision is what to do here in terms of setting up all of your defaults, okay? Naturally, when the lab result comes back from the lab will actually post whether or not the lab is abnormal. You know, if it's a critical lab, the system will be able to recognize that, and when the provider receives a lab result task, it'll automatically come back as a 1, okay? This is simply for the ordering piece, and we recommend setting it to medium. That's really up to the practice in terms of how they want to define that, but definitely setting the default priority is something that you can change in the future. Now, if I hit save, okay, it adds it to the list. I'm going to go ahead and close this just for a moment. And then what I like to do to refresh this list is just type in something for the system to do, like a little search, and then I can back out of it. And then as you can see, it added comprehensive metabolic panel to orders and charges. I can click on it, and right away it allows me to use this as a lab order. Okay? If you made any mistakes in the spelling, or let's say like some of the examples you see here actually have a CPT code tied to it. If you wanted to do something like that to help streamline your workflows in terms of charge posting, you can absolutely do that by going back into lab information. And we've seen various levels of customization in terms of what's in the descriptions. I've seen things as the actual test code associated with the lab order. Again, when we talk about workflows, if you were to task a lab order that has the test code next to it, then the lab tech would know which test code to order because they're receiving the task, and they would see an extension here representing either the test code, if that's what the practice has decided to do, or in some cases, as you can see, for example, we have a procedure code next to some of these as well. So again, it's up to you. If you wanted to add something, for example, we just put in a CMP, I can simply edit this, and then it'll allow me to put the number, either the test code associated with Quest Lab or LabCorp, for example, or if you use both, you know, I've seen something like this where you could put commas, right, and one of those would represent request, and the other would represent LabCorp. And again, the only reason why we've seen some of those things is to help streamline the workflow with the person receiving the task. So whoever's receiving the task, not only will they know what procedure code to post because it's there, you may use the test code so that the lab order, so the person sending the lab order knows what test code precisely to use for that particular lab order. So that's how you add labs to orders and charges. One more time, to add labs to orders and charges, you need to click on IntergyEHR, go to Tools, and then Lab Information. And then when the Lab Information screen pops up, you need to open up the Utilities section. Okay, open up the Utilities section right here. Click on Favorites, and there's your list. Okay. Now the next section is the tab right next to your lab favorites. Okay, it's tasks. Now this one sometimes gets a little mixed in with the actual ordering piece of orders and charges, meaning floor stock meds, using the examples here that we have in the training environment, in-house labs, radiology, referrals. The recommendation is if it's actually something that you need to order for the patient, whether it's a referral, an in-house procedure, a lab, everything should be in its appropriate location. If it's a lab, it should be in lab favorites. If you're ordering a referral, there should be a referral tab. Now, we could talk about diagnostic referrals versus specialty referrals. We'll talk about some of those recommendations in just a moment. But the idea is if it's not an order, okay, then how are we going to handle this? One of the examples I like to use is claims corrections. That's a prime example of one reason why you may want to task a claim correction because it's really not an order. Even though we're doing it from orders and charges, if it's an order, it should be in its appropriate order tab. If it's not an order, perhaps it's a task and we need to think about what's the best workflow for this. So that's why you'll see that in this area, there may be some redundancy in terms of what's in here versus what's on your actual order tab. I've seen things like lab order. I've seen things like referral order. So the recommendation is a lab order should actually be the actual lab test, and it should be set up in lab favorites. All of your labs should be in here. In terms of the other example I use, a referral order, well, a referral order can be anything. Okay, so if it's an order request for a referral to an endocrinologist, well, we should actually have that set up in a referrals tab with a list of different specialties that I can grab and actually send out an order request to someone to work that referral. Having a referral order in tasks really does not take advantage of all of the other default handling characteristics that we can leverage with orders and charges. So tasking should really just be things that I need to task outside of orders. So here's just a couple of examples: call patient, perhaps follow up, or the example I use as a claim correction. So for example, if I wanted to set up something here in this list of tasks, I cannot do it in the EHR. So lab favorites, as you know, we can get it right in tools, right under tools, lab information. But to set up the list of tasks here in orders and charges, I need to go to POMIS, as I mentioned earlier. Okay, now I already have the task setup screen already opened. I'm going to close it. As you can see, I'm inside of Energy now. I'm in Energy Promise for practice management. You need access to setup in order to get into tasks. And when you click on tasks, you'll see here there is a very long list of all kinds of task types set up in the system. Not all of these can be seen in orders and charges. What I mean by that is as you can see, there's a lot of tasks already set up in this screen. However, when I toggle back to the EHR, I only see 2. Well, the reason why is because rather than flood the EHR with all those tasks that may not even be related to something that's clinical in nature, there's an attribute for each one of these task types that says show on orders page in IntergyEHR. As soon as you change that flag to Y, then you will be able to see any task that's in this screen inside of the EHR. Okay? So right now, when I go back to the EHR, I can see that I have call patient and follow-up showing up. So if I look for those in this list here, call patient, as you can see, there is a flag, and it says Y to show the order in orders and charges. Okay? The other one was follow-up right here. Okay? So that's the reason why I'm able to see only 2 of all of the general tasks that are set up in Energy. If I wanted to add a new task type, very similar to how we set up the lab favorites, you do the same thing. Okay? In this case, what I did is I hit new, and now I'm going to type in my task type. Now, the recommendation when we start building task types and we're building the order types and the order subtypes in orders and charges, the code that we're going to use to set up each one of those tabs is very critical. And my recommendation is just try to make it as intuitive as possible. So when you're running reports or you're filtering your orders, your open orders screen in the EHR, it's easy to find certain things like lab orders and referrals and things of that nature. You'll see what I mean when I get back into the EHR. But what I'm doing now is setting up a new task type that I want to show up in orders and charges. Okay, so let's call this claim correction. Again, this is just an example of how I can use a task type to communicate with maybe someone in billing because I incorrectly posted a charge in the EHR and I want to send a notification about a claim correction. This is just an example. As you can see, the system automatically defaults, and I don't need to make any changes to the priority. But here's the key indicator right here. I want to be able to use this task type in the EHR, so I need to make sure that I change this attribute to Y. And I'm going to hit save. I'm going to leave this screen open for now and go back into the EHR. Now you'll notice when I hit refresh, it does not pop up, which is why I showed you earlier. What I typically do is I use the search tab to type in something and then I get rid of it, and then right away the system refreshes for you. So you'll get used to that with the setup. The refresh really is a security-based refresh, and there's certain things that you have to do in order to really refresh the entire system. So here we go. There's our new task type, claim correction. I can click on it, and it works immediately. Okay? Now, if you needed to make any changes or corrections because you noticed that it was misspelled, or let's say today you have a lot of tasks in there that are, one, redundant, or two, if it's a lab order that's sitting in there, and it should really be set up in lab favorites, or if it's a referral order that you see in there that really should be set up in one of the order tabs, then take the time to make sure that the lab order is there and the referral order is in its right spot. And then come back in here and hit edit, and then remove it from orders and charges. Okay? In this case, you're really not removing it, you're just hiding it from the EHR. But keep in mind, that task type can be used in any other place in the system. It just hides it from orders and charges. What I mean by that is if I go back to the EHR and I go to my day, and let's say I just want to generate a task from this screen here, I'll be able to use that task type from this screen. Okay, right there. So again, remember, task setup sets up tasks for the entire system. The only attribute that allows you to show it in orders and charges is this attribute right here. So far, we've learned that lab information is used to set up your lab favorites right here, and we put comprehensive metabolic panel in there. And secondly, we've learned that task types only show up in orders and charges, right? If it's flagged here with a Y to show on orders page in the EHR. Now, knowing that those of you that have joined are already using the system, perhaps are interested in maintaining and optimizing the workflow of the orders and charges piece, this is the perfect time now to evaluate what you have in your task list here inside of orders and charges to see if there are things that may answer the question as to why we're receiving orders for lab other, or someone is receiving a referral order, for example, that doesn't have a description tied to it, and I have to actually double click on it to see all of the details. Keep in mind, when we talk about default handling and instructions and notes, whenever you click on a task, notice I don't have any of the functionality that an order is supposed to do, such as, right, the whole closing of the loop, who the request went to, when it was marked as ordered, when it was resulted, when it was closed, making sure that the requires result is there so that no one can close it without a validation. So you're losing a lot of the core functionality when we talk about computerized provider order entry. Tasking is not computerized provider order entry. Tasking is just a tab inside of orders and charges that allows me to send a task to somebody. Okay? All right, so enough of lab favorites and tasking. We're going to talk about now everything after the charges tab. Okay? You'll soon notice when we get into the order setup that these first 5 tabs, meaning predictive order management, RX, labs, tasks, and charges, are not accessible in the order setup. Okay? They're not accessible in the order setup because order setup only applies to, I like to say, things that we used to have on our paper encounter. So if you remember back to the old days, whenever we used the paper encounter, there were various sections on the encounter that listed out all of the services, whether you call them basic services, core services, whatever services were offered by the clinic, okay, they would have boxes next to each one of those services that you checked off. And then next to the description, typically you saw a procedure code. That way, whenever that paper encounter got up front, the person who's responsible for inputting those charges already knew what the order and the description was, along with the CPT codes. That's what these tabs are used for. You're literally taking the boxes inside of those services, and you're setting up tabs based on the header of that section, and then under that section, you have all of the details. So that's what we're going to go through now, how to go in and set up these tabs and the associated subtypes along with the order. Okay? Now, this database obviously already has a series of tabs already set up, which we can modify or we can add to. Okay? What I'm going to show you first is the basic setup, and then we can talk about how to add new subtypes or new tabs at the top of the screen. So the first thing I'm going to do is go right back into IntergyEHR, Setup, and Orders. Okay? When you click on Orders, you're almost going to see like another copy of the actual Orders and Charges screen in the background. So for example, if I move this screen a little closer to the top here, you'll get a better idea of what I'm talking about. Okay? So you're looking at the setup right now as I move across these tabs. Okay? If you look at the actual Orders and Charges screen behind the Orders Setup window, you can see that it looks exactly the same. And there's my vaccine, and there's my others. Okay? Now, if I highlight the Floor Stock Meds tab and expand all of these selections in here, you can see that it still almost looks the same, right? Floor Stock Meds. Under that, I have creams, ointments, and then under that, I have 2 orders. And then the next, I see emergency drug kit, and then under that, I have more orders. Next section, inhalations. Under that, more orders. So let's talk about what each one of these are. Okay? The Floor Stock Med folder, that's actually called the order type. Okay? The order type is the actual header itself. What I mean by that is if I was to create a new order type by clicking on this button right here, you'll see that there's an option here that says, okay, do you want this order type to show as a tab in Orders and Charges? Well, if we were creating a new tab, absolutely. Your new order type will show up as a tab. I'll get back to this in just a moment. So again, Floor Stock Meds is the actual order type, which is why you see it here in the very, very beginning as we begin to build this list of Floor Stock Meds. Or if you're working with in-house labs, you'll see when I click on in-house labs, the very, very first is the actual header itself. Okay? So the question is how do we get these separate categories in here? Because as you can see, Floor Stock Meds in this particular example has various categories: creams and ointments, emergency drug kit, inhalations, insulins. Well, categories are good because you may have different types of medications that you provide your patients. Some of them may be ointments, some of them may be injections, some of them may be something that I inhale or that I take orally. So if you want to set your system up with these various categories, you're going to use a subtype. That's what the subtype is used for. The good thing about subtypes is every time you create a new subtype, you can have specific default handling characteristics for everything ordered under that subtype. What I mean by that is this. So under creams and ointments, I can set up all of my creams and ointments with default handling characteristics because everything is under a separate subtype. Okay? So if I wanted all my creams and ointments to be taxed to someone other than where my injections are done, I can do that because it's set up under a different subtype. Let's highlight inhalations and hit edit. Again, a different subtype. So if I hit edit there, as you can see, I have a whole brand new list of default handling characteristics for this section as well. Why is that important? Because you may have different requirements for that particular set of floor stock meds. A good example would be referrals. As you can see, under referrals, there is no list of categories here. It's just a referral tab or an order type called referrals. And then under that, I don't see a subtype. All I see is a basic list of different referral specialties. So I can only handle the characteristics of these orders with one option, this screen right here. So any referral order that I select is going to use these default handling characteristics that we'll talk about in just a moment. If you try to edit cardiologists because you have someone that handles separate referrals just for cardiology and I hit edit, I don't have that option. I don't have that option of saying, okay, every time someone orders a referral, I need this to go to this individual. You can't do that here because cardiologist is set up as an order. If I was to create a subtype called cardiology and then under that put my cardiology referral order, then I'll be able to put separate handling characteristics for that particular referral order. But right now, the way that this list is set up, which is a list of orders that you see here, are all going to be handled by the way this screen is set up right here, the way this order type screen is set up. Again, the difference between this setup versus floor stock meds has different subtypes. So each subtype has its own default handling characteristics. Okay? So again, new type is the actual tab. Subtype is this, what I have highlighted here, which is the next section that belongs to that order type. And then the third button would be the actual order. What are you actually going to be ordering for that particular section? So if I was to hit new order, notice how I have creams and ointments highlighted. If I hit order, or new order I should say, the system's assuming since I have that section highlighted that I'm going to put in a new order, okay, under this particular section. Let me demonstrate that to you one more time. So if I highlight inhalations and I click on new order, the system will assume since I'm highlighting that section or that subtype, it wants me to put an order in here. But the cool thing is it doesn't matter what section I chose. I can grab any section under floor stock meds and add some additional orders. Okay? So for example, right now I have, if I uncheck show detail, I can see I have all of these different subtypes for floor stock meds. Okay? If I wanted to add a new medication in here that's given orally by the clinic, then all I need to do is add a new order. I would just click new order, make sure that I am on the oral subtype, and then I can type in what I want to order. So if I type in Tylenol 500 milligrams and I hit save, it puts it there. And it's real quick. Once you add a brand new order, and let's try refreshing this and see what happens. And I go back into Floor Stock Meds under oral. You see Tylenol right there. Okay? Now notice there's no way to search when we're using the traditional order tabs. The only tabs that allow you to search for something is when you're using your lab favorites or your tasks. Once you dive into your computerized provider order entry tabs, you really need to make sure that you have it set up in a way that is intuitive, because you will be required to actually scroll in order to find the order that you're looking for. Now, it is in alphabetical order. If you look at the subtypes, if you look at the orders, the system by default puts everything in alphabetical order. So just keep that in mind as you're setting the system up. And yes, numbers do come before letters in terms of the setup. So if you use that alphanumeric characteristics in here, you may be able to leverage some of that coding abilities if you want, or if you want to put A in front of a description to keep things on top. Those are just various workarounds you may be willing to work with if the practice is okay with that. But just keep that in mind. Everything is in alphabetical order, including the order tabs. So if you look at the order tabs, floor, stock meds, in-house labs, office, procedures and tests, radiology, referrals, vaccines, the order types by default, by system default, by design, are also in alphabetical order. So just keep that in mind during the setup. Okay, I'm going right back into the order setup, because what I want to talk about now are some of the default handling characteristics that come with the ordering system. And for that, I'm going to use the referrals tab. And the reason why is because referrals usually take some time. Whether you're dealing with a patient who doesn't have insurance and may be going on their own, and you're waiting for a result to come back, which may take time because the patient is now on their own, or maybe getting assistance in terms of getting an appointment, and it may be 3 months down the line. Or if the patient does have insurance and you want some default handling in there built around how long it usually takes to get either an appointment or a result back, there's certain things that you need to be aware of that you can leverage the system to help you when it comes to reconciling open orders. So let's talk about some of the default handling characteristics here for this subtype. Okay, so I'm going to edit referral because that's the actual order type for this section. And as you can see, there's a lot of things in here that can be defaulted to our advantage. Okay? So for example, if we look at this screen the way that it's been set up right now, the code is REF. So logically, I mean, one would assume that REF stands for referral. Keep those codes in mind whenever you're working with orders and charges. If you're setting up a brand new tab, okay, make sure that the code is something that makes sense. There's really no way around that one. Come up with a code that makes sense. And I did remind you that I would show you how impactful the code is. I'm going to take a step back for just a moment, and I'm going to go into orders. Okay? So from the EHR in my day, if you click on orders, I have access to every single order type in the system. Okay? However, the order type is pulling from the code, not the description. So can you imagine if you have a code that's called 321? Unless the user that's monitoring code 321 knows that that's my referral tab, most likely the super user or whoever was maintaining or setting up the system is going to know that. Because as you can see here, this is a very good example of how things can get out of hand in terms of monitoring the right folder or the right tab to monitor labs or injections or procedures, okay? So yes, it's highly impactful, not only for the person who's monitoring open orders, but when you run reports. If you're running an open order report, you have to know that I have 3 procedure tabs. One is labeled Pro, Pro 1, and Pro 2. You have to be aware of those characteristics of the system so that as you're building and maintaining orders and charges, you know, things are much more intuitive to the eye. Now, if you're already dealing with a similar situation like this, guess what? The only way around it is to create a brand new tab before deactivating the existing one. You can't delete it. And the reason why is because you have existing orders out there. So all of this information that you see here is not going to go away until we've resolved all of the open orders for that particular section. Until then, you can deactivate. What I mean by that is I'm going to go back to the order setup. Actually, let me set this up on referrals. So if I go back into the order setup, notice at the bottom, you do have the ability to deactivate. Deactivating allows me to hide that order type so no one uses it anymore, right? But you cannot delete anything until you've worked all of those orders. So rest assured, you won't be able to delete anything in here if it's been used, okay? But if you want it to be hidden, you need to deactivate it if you don't want anyone using that particular order type anymore. Or you may want to get rid of the entire tab itself. My recommendation, though, is you create a brand new tab. And then once the entire tab is set up, then you can deactivate the existing order tab or order type, okay? Another example, I'm on the procedures and tests. If I hit edit, I can see that the code is Pro, okay? Makes sense. Pro, procedure, just as long as you have some sort of spreadsheet or some sort of documentation that actually has listed how the system is set up, then it should not be an issue running reports and maintaining the system or teaching someone, look, when you're filtering your open orders in my day, Pro is everything that was ordered from the procedures and test tab. So that's why it's helpful having documentation. And if I go back to referrals, as you can see, the referral type is REF. Okay? So yes, the code is important, and obviously the description is what the user is going to see in orders and charges. We already know that this tab is set up, this order is set up as a tab in orders and charges. Okay? Just to give you an example of how that works, if I was to put in a brand new type, and let's call this, how about external? This is something that I've seen before, external referrals. Or referrals, or you know what, internal, because we already have a referrals tab and it looks like everything was like specialty. But okay, if I just stop right here, because I want to create a new tab called internal referrals, and I labeled it INTREF, internal referrals. If I hit save right now, it's going to add that tab to the order setup. And as you can see, if you look in the background, it's already there. Okay? It's in alphabetical order. So you'll notice that in the majority of the system setup, rather than type in internal referral, you'll see referrals external, so the tabs are close together. I can do the same thing if I hit edit. If I want to make this referral internal, I can do so, and then you'll see that it'll keep the tabs a little closer together because everything is in alphabetical order. So if you look at the setup in the background, you have a referrals tab and then a referrals internal tab. Or if I want to change this one to external, I can just pop in here and modify the description. But you can't modify the code. Keep that in mind, okay? Once you create a code, that's reportable code. So now I'll be able to run reports. And for that reason, as soon as that code has been used, it can't be changed. So just keep that in mind. So now that we have two tabs, one for external, one for internal, let's build an order for an internal referral. So let's say this organization that we're working with has an internal dermatology department. I don't have to order referral and have it go through a different method because I have the services in-house. So we're just going to create a tab called Referral Internal. As you can see, the tab is there. And now I'm going to type in New Order. Whoops. Since this is the only subtype, that's the reason why it says under the subtype here, no subtype. Let me clarify that. Because Referral Internal is the actual order type, if I hit New Order, the system's automatically going to say, okay, there's no subtype. What's the order description? So dermatology is going to be my first order. If I hit save, it adds dermatology as an order. Even though you really can't tell that it's an order because it's not set up as a link, if I close this for just a moment and go to my referrals internal tab, as you can see, it's there. Okay. Now, what the system doesn't know what to do with the order is this. If I click on dermatology, the system doesn't know how to handle the request, which is why I get this pop-up screen. If you do not want this pop-up screen to show, then perhaps one of two things. We don't have any default handling characteristics set up, or the provider's preferences need to be looked into. So what I'm going to do is go back into order setup. I'm going to find the dermatology order under referrals internal. And what I want to do is I want to set some default handling characteristics for all of my internal orders. Okay, before I do that, I'm going to go ahead and add another order. Let's say I have a women's services, or maybe let's say an OB department. For now, I'll just put women's department. I mean, you could put gynecology. I mean, that's an option too. Just so you can see how the system begins to start building that list. Okay, I have the actual tab and orders and charges in the background so you can see what's going on here. Now, what I would like to do though is tie some characteristics to these orders by going into the order type right here by hitting edit, so we can finish filling out the order type and the default handling characteristics for this type of an order. So as you can see, you have a way of defaulting the priority, which I'll elaborate more in just a minute, who this order should actually belong to. So if you have in-house services you only have one dermatologist, for example, you can default it. You can default it to that provider and that particular service location if you want to, that facility. Okay? A lot of times this information is not known because the referral goes out, it's handled by the insurance. We have to wait on information to update the referral. So this information is typically left blank. But you can prioritize these orders. The best way to utilize priorities is to create a default priority by subtype. So for example, let's say you wanted to be able to order something stat, you can create a dermatology order and default it to 1. You could also create another dermatology order so that it's not stat. So if I wanted to order a dermatology stat, for example, I can create a subtype called dermatology stat and default it to 1. If it's not stat, you can create another dermatology order that's defaulted to level 3, which is low priority. This is something a little bit more advanced, but in terms of priority, just as long as you have something defined in writing in terms of a standard operating procedure at your clinic, you can use these priorities however you want. Priority 1 is something stat, so it needs to be done, let's say, within a week. Priority level number 2, okay? This is something that is not stat, but it's not routine. It's somewhere in between, so this is something that needs to get done within 30 to 60 days, for example. Priority number 3, routine. That's something that you can do maybe within 90 to 120 days. So if you think about how you want to set your priority levels up, you can leverage the system and create subtypes based on priority. Think about that, because that way it may help manage your referral orders over time by using default priorities. Requires result is extremely important. Why? You do not want an order to be closed without the system reminding you, hey, before you close this order, remember that I need a result. Yes, the system allows you to override that, but it is a good validation method to use whenever closing the loop. Results due. This is very, very similar to setting up lab favorites. So if I'm ordering a dermatology referral, okay, when do I expect to see those results? Okay. So let's say I put here 30 days. Okay, patient got an appointment for next week. I should have the results within a couple of weeks or no more than 30 days. Keep in mind that the way results do work is a clock begins ticking the minute the provider saves the order and orders and charges. Okay, so if you want the system if you run a report on orders that are due and you don't have this date set properly, you may have things show up on my orders due report that are really not due yet. The best example is what I used earlier with your lab favorites. If all of your lab favorites are set up with 0 days, that means that the next day the lab is overdue. So realistically speaking, whenever you're setting the system up and we're talking about referral orders, if you know that it's going to take 3 months for this patient to get an appointment for their breast mammogram, then the results due should reflect what that time span is. Because if not, the system is going to assume that all these orders are overdue. And it's not that they're really overdue. It all has to do with the setup. Now, what type of result are you expecting back for this dermatology order? Okay, is it an image? Is it a document? Is it a lab result? Okay, now if it's an image, put image there. Now, it may not be an actual image coming from the dermatologist. It's an actual piece of paper that's scanned in as an image. Okay, so if that's the workflow at your practice location, so then yes, you will be selecting image here. Text allows me to result something in type. A document is very similar to an image. Lab results, I'm expecting an actual lab result to come back. Now, instructions allow me to place specific instructions for this order, or I shouldn't say for this order. Keep in mind, we have one order type here. So every single one of these orders that fall under this order type or this subtype, okay, these instructions will apply to all of these orders. Just like ask at order entry questions. If I was ordering a radiology, a chest x-ray for this patient, and I wanted the system to remind me of, to ask me questions before I actually submit this order, these questions apply to every order under this type. If you don't like that type of setup, and you only want the system to ask you questions for certain orders, that's when you have to set up a separate subtype. So yes, I would not mix in my radiology orders with my referral, which is mainly the reason why there's a separate radiology tab for ordering radiology services versus a traditional referral order. Or you can have one referral tab, but under that referral tab, you would have something like this, referrals internal, and then I would create a new subtype called radiology. That way, everything, all my orders under radiology will be kept separate. And I can create default handling characteristics for these orders. So for dermatology and gynecology, those orders will use these default handling characteristics. And for my chest x-ray, these default handling characteristics. So this is just one way you can handle two different types of referral orders if you wanted to mix your specialty referrals and your diagnostic referrals on one tab, or do something like this where you have a separate tab for radiology. Here's all my CTs, all my MRIs, all my ultrasounds, and keeping it separate from referrals. It's totally up to you. But just keep in mind that if you have a referral order that you want to tie separate default handling characteristics, you can't do it unless you create a separate subtype. So to be quite honest, you would have to create various levels of redundancy to set that up. You know what I mean? So if you want a high priority X-ray, then you would set up an order with a subtype for a high priority X-ray. If you want a traditional X-ray, it's not high priority, you have to set up a separate subtype for all those. So you could take the time and make this really, really, really detailed, or you can just make a general, list of referral orders. Okay, so aside from the ask at order entry questions, which by the way, I did not show you actually how to put those in there, okay? But as you can see, there's already some defaults in here, okay? So for example, if this had been a radiology order, you could have the system prompt the person who is ordering this to ask you, are you pregnant? Do you have any metal in your body? Okay, so yes, these ask at order entry questions will pop up if you have them tied to the order type. Unfortunately, we do not have the capability of tying these order entry questions to labs. Okay, so for labs, the best thing to do is for them to be listed as a note in the instructions. I can show you that in just a moment. Now, at the bottom here, again, we're still working with referrals. So every time someone orders a referral, what do you want the system to do? Do you want the system to send it to a user to complete it, then that's what you're going to do here. Do you want the system to mark it as ordered and don't task it to anyone? That's what this is used for. Or do you want me to order and just close it immediately? Okay? For this example, we're going to go with send request to user for completion. Now, ordering a referral does not have a service code, I cannot tie a procedure code to a referral order and track it. Okay? So really, there's no procedures to map here because I'm not charging the patient for the referral. So we're not going to use this particular item right here. We'll actually just ignore it. You can leave it where it's at, where it says ordered, because nothing is going to post because I'm not tying a charge to it or a CPT code. Now, this is actually pretty cool. If you have correspondence letters already set up in the system, I could take that correspondence letter and tie it to my order so that every time I order a referral and it gets tasked to someone, that person working the task, they don't even have to search for the referral order. All they need to do is mark it as ordered, and the system will print out the referral for them. It'll print out the correspondence letter, the clinical correspondence, automatically. So just make sure that if you do leverage the correspondence templates with your orders, set it in here and make sure that you default it so that it prints whenever it's marked as ordered. So if I was to test this, okay, if I click on dermatology, okay, I'm going to mark it as ordered. Notice how the system automatically knows to print on save because I set a correspondence template on it and I said print it whenever I mark it as ordered. So if I was to hit OK, remember I set up those questions? When I try to hit OK, it says, wait a minute, you need to answer some questions before you can order this. So that's why this is here. So if I was to order this, okay, the system will automatically prompt me to print out the letter. So if I was the person working this referral order, I don't even need to search for the template because it's already there. All I need to do is preview it and make some changes and print it out. So again, it speeds up the workflow is really what this is doing for you. Now let's talk about charges. There are some orders that are necessary that we capture procedure codes or capture orders that really need to be tied to services that the center needs to keep track of, or perhaps charge so that if this is a service that the patient should really be paying for, that it actually accumulates in the patient's account so that they are aware of how much money they owe. That typically happens with labs. That typically happens with certain procedures. And whether or not the actual patient is being charged for something is something that you want to track the productivity for. For example, if you're ordering EKGs, if you're doing other things in-house like x-rays, ear lavages, for example, certain things that have an actual service code or a billable code tied to it, you could actually attach it to an order so that the charge is captured at the order entry level. Okay? So for example, let's see what we have here under procedures and tests. So let's say you capture, you want to tie a service code to a hearing test, for example. Okay? If you edit the order, you'll notice that there is actually a section where you could default the procedure to post for this particular order. If you are going or monitoring or maintaining your orders and charges now, and as you go down the list of orders, you notice that certain things are missing, that could be the reason why you're noticing that you're missing charges for certain things. It happens a lot with immunizations. And depending on your workflow, you may be duplicating charges or missing charges depending on how you have it set up. Okay? I know that there are certain centers who will set up the charges so that the only way that the charge can appear in orders and charges is if they use the immunization module and they administer. There are other workflows that tie the procedure to the order. So, for example, if I come here, I'm not sure if we actually have this set up in here, but I can look it up. Maybe it's set up under hearing test. So let's just use hearing screen as the code that I'm going to use to track this service. So I'm going to save this. I already know that I have a charge tied to hearing test. Okay. What I don't know is when is that charge going to drop? The only way to know how the system is going to handle that is by going to the order type and looking at when procedures are mapped, how do you want the system to handle it? Well, right now, it's set to ordered, which means that as soon as someone marks it as ordered, the charge is going to drop. Right now, it's not going to be marked as ordered because it's sent to someone for completion. But what I'm going to do is change it just for the purposes of showing you all how this actually works. So what I'm going to do is go into procedures, right? Which one was that? Procedures and tests. I'm going to click on hearing test. You notice how the charge dropped right away? The charge dropped right away because I set it up to drop whenever it was ordered. So what I'm going to do now to show you how we can leverage the system to drop the charge whenever the person who's responsible for resulting it drops the charge. If I go back into setup, and change the way that the default handling characteristics are, okay, I want it to drop the charge when it's resulted, which means this is going to be tasked to someone to perform it, and then they result it, and then the charge drops. Which means now, if I was to order this, it shouldn't drop a charge. It should only what? It should only order it. So if I click here, let me select the diagnosis first. If I click here, notice how it didn't drop the charge. It's now asking me to send it to someone to complete it, which is what I'm going to do. I'm going to do just that. As you can see, no charge has dropped yet. But here's the referral. Okay, so if I grab this order request, okay, and I complete this order, okay, I'm going to put a result. I'm just going to put actually, you know what, I'll just mark it as resulted. Okay, just mark it as resulted. And because I resulted it, the charge drops. So again, whenever we talk about tying charges to your orders, you have a few ways that you could actually handle the way the system drops the charge, okay? we did two methods here for the hearing test, okay? What we said the first time was drop the charge when it's ordered, which means as soon as someone marks it as ordered, the charge is going to appear. Or we can do resulted, which I just showed you. As soon as someone results an order, the charge falls, okay? The last option is closed, meaning no charge is going to appear or no charge is going to show up in orders and charges until that order is closed. Now, if you don't want a charge to post at all, then you can use that option there. Okay? Important to know, extremely, extremely important to know, whenever you have procedure codes that are mapped to an order, you have basically three ways to handle it: at the order level, at the result level, or at the close level. Okay. Now, in terms of basic order setup, okay, I'm just going to take it back just for a moment. Remember, your lab favorites, you have to go into IntergyEHR, Tools, Lab Information, and then when you get into the Lab Information window, you're going to open up Utilities. When you open up Utilities, here are your favorites. Just maintain this list right here, and that will update the Lab Favorites tab in Orders and Charges. For your tasks, remember when we set up claim correction, you're going to go right back into Practice Management or PAMIS, and you're going to go into Setup, Tasks, and then here is where you maintain all of the task types in Intergy. The ones that appear in Orders and Charges inside of the EHR all have a flag of Y to show on the Orders page in IntergyEHR. Okay? Now, when we talk about general order setup, you need an order type, which is the tab that you see first. You need a subtype if you're going to categorize your orders, and you need an order. You need three things. You need an order type, an order subtype, and an order. And I'm going to show you that again by going into IntergyEHR Setup and go into my orders. And if you see these first three buttons at the bottom left, you need to start with a type or an order type. Once you have your order type set up, the decision you need to make is, do I want to create various categories for this order type? Or ask yourself, is there a need to set up different order types for this tab? If not, you can just jump right into creating the various different orders for this order type. Okay? Once that piece is done, if it is a service that needs to be captured, if there is a CPT code that needs to be captured, then what you need to do is you need to highlight the actual order and hit edit and make sure that the procedure to post for that order is sitting in this window right here. Okay? If you happen to select something and you do not find what you are looking for, that means that the procedure code does not exist in the database. Okay, it does not exist in the database. So if I try looking for something and I am not finding it, again, that means that the code just does not exist in the database, and I cannot post a procedure associated with this order until someone sets that up. Some of the other recommendations I made, if you are actually doing some housekeeping, keep in mind that you're in a live environment, or I should say a living setup environment. So as soon as you make changes, the practice is going to see those changes. So you really have to tackle the setup very strategically. If you're thinking of making changes to the order setup, Some of the other things I mentioned, for example, was, now that we're going through this and realizing the impact of the code that's being used for the order types, understand that you cannot make changes to those codes once you've set it up. So if you want to make the system more intuitive in terms of monitoring your open orders in MyDay and running your reports, you can still create the new section. Just do not deactivate anything until that new section is set up. But one thing to keep in mind is until all of the previous orders are worked, this section here is going to look very convoluted. It's going to look very confusing, okay? So if you do have multiple referral tabs, multiple radiology tabs, multiple procedure tabs, it's helpful for the staff to be aware of what they're looking for whenever they highlight these sections, okay? If you notice, lab only has one section. The reason why lab only has one section is because in orders and charges, we should only be ordering labs from one section, and that's lab favorites. If you have lab other, external lab orders, or reference lab orders, or specialty lab orders, and you're using that today, okay, that will cause some confusion when we're monitoring our open orders here in MyDay. But I'm hoping now that you understand how that impacts this particular screen as well as your reports. So if I wanted to monitor all my open orders, I have to remember when I run my reports to pull lab, to pull lab other, to pull external labs, to pull, referral, reference labs. There's so many things you have to keep in mind. So yes, it's extremely important when we talk about order setup that you think about these things as well. Now notice there is a vaccines tab here. This is simply an option, okay? This is simply an option, and the recommendation here is that if your practice orders vaccines from orders and charges in an effort to send the task as a reminder to the nurse, make sure that the description matches what's set up on the immunization schedule, okay? In addition to that, you may have different default handling characteristics based on that vaccine, which is why you see here that each vaccine has its own category. Again, this is not recommended. This is obviously an option that if you are using orders and charges to generate a task, which is absolutely fine, because that way there's a task that's in the system and that patient may not get their vaccine done today. Well, at least there's something that you can monitor in the systems in terms of a task. Keep in mind, one of the most important things to remember if you're utilizing vaccines to send your lab order request, your vaccine order request, is that if you have a charge tied, you need to make sure that it's not duplicated on the immunization schedule. Here's what I'm talking about. It will not hurt to review the list of vaccine orders to make sure that if you are capturing charges at the administration level, that you do not have anything in here. Let me look at another one here just to see if something might pop out at us here. So there's nothing in the procedure to post for the order. The reason why that's important is because if you do have a charge linked to the order and you have a charge linked to the immunization, guess what's going to happen when the doctor orders it and then the staff goes into the immunization module and administers the vaccine? You're going to get a charge at the order level and you're going to get a charge at the administer level, which is why you want to make sure that your vaccines, okay, are set up to post the procedure whenever the vaccine is administered. So it's one or the other. It's really one or the other. Do you want to capture the charge when the task is being worked, or do you want to capture the charge when the vaccine is administered? If you want to capture it when the vaccine is administered, make sure that the procedure code is here, set up on the vaccine. If you don't want that, then you need to make sure that you capture the charge on the order itself, which would mean that you would need to make sure that the charge is set up here. Okay? What you don't want is the procedure to be in both spots, because you will see duplicates. Either way, I would recommend reviewing everything. Go down the entire list of your setup and orders and charges. You may be surprised to see that you either have the wrong code tied to a procedure or no code at all, okay? Which could be, reasons why your utilization for certain services is down, or you notice that it's not being captured, okay? Or there's money being left on the table because for whatever reason, the charge is not tied to that, and the front desk is forgetting to drop that procedure. Well, leverage the system to have the system remind you or drop those charges automatically. Now, in terms of some basic fundamentals in terms of using orders and charges, we kind of have been doing this as we go along. But as you can see, the setup is truly key when it comes to making sure that orders and charges is really working the way that it should. So some of the things to keep in mind, and aside from going down the list and seeing that you have all your charges captured, take a look under your task list and really evaluate things in there that should not be in the list of tasks. If it's an order, put it in an order tab. You don't order labs from tasks. You don't order immunizations from tasks. You don't order referrals from tasks. But if it's something that you want to send a notification about, such as, please call this patient, or follow up on this, or this patient needs to come back in 3 months, I'm going to send a follow-up. Or if you need to have something corrected because you dropped an incorrect charge. There's certain things you may utilize this tab for. And finally, labs. The recommendation is to use lab favorites, okay? The purpose of lab favorites is not just for us to have a way to search for what we need, okay, rather than scroll down a long list. Lab favorites is actually linked to lab portal services. In other words, when a provider sends a lab order task to their lab techs and they work the task, the system is designed to automatically open up the lab order requisition that's going to the reference lab. So if you use lab favorites, right, you're leveraging the system in terms of the way that it was designed, the way that it was intended to work, okay? So when we talked earlier about setting up results due days, okay, if I click on this comprehensive metabolic panel that we ordered earlier, notice that the due date is set to the 30th, okay? It's set to the 30th because I specified in the setup this result is due within 4 days. Doesn't matter what patient you order it for. When I order a CMP, the setup says expect the result within 4 days. So if you run a report on this patient tomorrow to find out why I haven't received the CMP, the system's not going to show that it's overdue because 4 days hasn't gone past. What you really want to pay attention to there when you look at your lab favorite setup is that your lab orders are not set up with 0 days. 0 days means as soon as I order it, it's overdue. Okay? So here's the way that this works. The default shows up at the top. However, if you don't want to use the result due date recommendation, then use another date. Okay? The system is designed to give you both options, right? The recommended one based on the setup or another due date. So if I choose 7:30, okay, all I have to do is send this to whoever my lab tech is. Now, the majority of the time, the providers are tasking tasks to a pool, sort of like a lab pool or an MA pool or a dedicated lab technician. Depending on how your workflow is set up, you need to make sure that the providers are setting up their defaults so that the system doesn't ask them who to send it to. All the providers need to do is visit their general preferences and on the order tab, specify where they want lab orders to go. You can do the same thing with all of these tabs, by the way. I can set up different default handlers based on all these different order types that you see here up top. Just to show you what I'm talking about, if I go into general preferences and I go to the order type, here it is. I can take any order type and specify who I want it to go to. So explain to your staff, to the providers, that, you know what, instead of having to select the lab pool or the MA pool or the lab technician every time you order something, just stick it in your general preferences, never have to worry about it again. Now, all of these tabs work exactly the same way. So if I was to go to floor stock meds because I wanted to order, let's say, some insulin, this patient needs insulin right now, okay, and I click on this order right here, the system does the same exact thing. Okay, it needs to know how to handle this order. Now, why is this screen popping up? Again, the reason why it's popping up is because the system is set to send this to a user to complete it, and it doesn't know who to send it to. Okay, so yes, there should be a default for this one as well. Now, let's say I don't need to send this to anyone because I have standing orders in place. Well, then mark it as ordered. That's another option. If you mark it as ordered, the system doesn't pop up the order details. It simply just shows up at the bottom, just like it does here in orders and charges. So yes, the way that these tabs work are the same exact way. You are going to get a pop-up screen wanting to know, the system is going to want to know how to handle this order. Mark it as ordered, mark it as resulted, send it to someone so they can complete it. That's how it's used. Now, these other tabs that we haven't gone over, charges, prescriptions, and predictive order management. Charges and prescriptions, the nice thing about these two tabs right here, charges and prescriptions, is that I can handle both of those by using predictive order management. That's the cool thing about predictive order management. Predictive order management allows me to utilize either the patient's current medication list or renewable meds, or pull from clinical decision support to answer my treatment plan needs. What do I mean by that? As you can see, I have essential hypertension highlighted here in orders and charges, and my charges card here at the bottom. The system is already telling me, okay, what are some options for treating essential hypertension? Okay, I could actually take this a step further and say, you know what? Let me look at it and compare essential hypertension with all of the patients that are part of my organization, part of my clinic, and at the same time compare and have the system tell me, looking at all of the ordering providers, how this could be handled. Meaning, looking at essential hypertension and having the system calculate what drug, what order, and what procedure I can use. So again, this is just an example by highlighting a diagnosis, how the system is recommending 3 medications. As you can see, in this particular example, lisinopril is the most frequent at 36%. Okay? When we look at orders, I am not sure what profile 1 and 2 is, but if you look at A1C, it pops up. 29% of the time, the clinic is using this particular lab order for all of their patients. And if you look at the other screen there, the last screen to the right where it says procedure, okay, when we talk about charges, I don't have to go to the charges tab. I can utilize this screen because 29% of the time, the practice is dropping a 99204. Well, you know what? If this is a new office patient visit, okay, at a level of 4, I can use that code. In addition to that, you'll see other codes on there that have been used before for this diagnosis. So this may be the performance measure that I need to track for hypertension. So rather than go to the charges tab, okay, or very carefully, steer away from the quality measures form, which is something obviously we don't recommend, but you will see not only charges from the note appear here at the top left that I could actually drop into my charges cart, but you will actually see them here because all of the charges that are being posted and saved into procedure history show up here in the Predictive Order Management tab. So just look at this screen, Predictive Order Management, as a way to leverage the system in terms of making clinical decision support for the provider. So yes, in addition to the prescription, the order, and the procedure, at the top left here, you'll notice that I could actually capture procedures from my encounter note. So just to demonstrate to you how that works, if I'm working inside of a form, for example, and I'm clicking on something that's tied to a procedure code, so let's say, for example, I'm tracking the performance of this patient's A1C, and I say that their last A1C is between 7 and 9, which is tied to the 3045F. Any finding that you click on in the EHR that is tied to a procedure code, whether it's a CPT or a CPT2 code, is going to show up here in Predictive Order Management, just like it did now. Over on the right, you have patient current medications, but guess what? I can change this window for any of these options that you see here. Active allergies, orders for reminders that are due, orders from the last visit. Patient information, again, this window you already have over here on the left. But the nice thing to know is I could actually change this to whatever view I like. So if you want to only look at medications that are currently renewable and have my procedures for the encounter on the left, by all means, you can use this, and I can come over here and say, this medication is renewable, click on it, and it drops right here. So you're actually using the system as a way to leverage the technology and the decision support without having to visit these other tabs. Of course, you may not find everything you're looking for in there at an instant, but you always have your RX tab here to default on, or any of your other specific order tabs here. But again, remember, Predictive Order Management is really there to make that clinical decision support you need based on a specific diagnosis. So just as long as that diagnosis has been used, you will find some information here that's helpful when it comes to treatment planning. So we're at 4:47, and I want to make sure that I give everyone some time to ask some questions, since we're almost at the 10-minute mark, and I want to give everyone a fair chance. So what I'm going to do is I'm going to unmute the line really quick, which I have done so. Can you guys hear me?
Yep.
I'm not sure. It doesn't look like any more folks have joined. I actually have not taken the time to look at my attendee list here. But does anyone have any questions? Is there something that you would like for me to go over again or discuss?
I'm okay. I actually, unfortunately, have to miss a good part of it because of interruptions here on my side. But since this is going to be recorded, I'm probably going to watch it sometime after hours.
Not a problem. Not a problem. Yeah, it actually is being recorded, and we just have to do some scrubbing. And you know, Jose, if you have any questions, you know, you can always reach out to me.
Absolutely, absolutely. Thank you so much. Looking forward to the one tomorrow.
Got it. I think we still have. I'm not sure if we have Cynthia still on the line. Monique, Yvonne, do you guys have any questions?
Hi, Brian. It's Monique.
Hey, Monique. How are you?
Good. How are you?
Good. Thank you.
Good. I have a question. When you were going over the Ask Out order entry questions that we could add, it looked like there were a lot of duplicated questions. Is that for a reason or?
Yeah, I know exactly what you're referring to. It most likely the reason why is because this is our training system that we're in right now. Have you actually gone to see if there's a lot of duplication in your live environment?
I haven't checked. Actually, we don't.
Yeah.
We haven't really set that up in our system, so.
Right. So yeah, I do see exactly what you're talking. And I said the same thing whenever I ventured in here. And I said the same thing to myself. So do not actually know why. So I actually took a mental note of this, and I'm going to check into this. But the thing to keep in mind here is that when it comes to lab orders, we can't leverage the ask at order entry questions when the doctors are ordering their labs. And I know that has been a constraint. And I just lost power to my machine. I'm so sorry. But the best thing to do would be to place those questions inside of the instructions as a reminder when they're ordering. And you could actually create quick text, and you could actually create quick text in there for them to use.
All right, sounds good. Thank you.
Excellent. You're welcome. Is there anyone else that has any questions?
Hi, Brian. It's Sandra. You want me to launch the poll for you?
Yeah, can you do that? Because I was actually going to plug back in, but if you can launch that for me, that would be great. So for those of you that are still on,
I thought I could, but it's not letting me. Sorry about that.
Not letting me. Okay. Well, we have the list of the users, and I believe 5 individuals joined. So what we can do is we can send out a poll tomorrow, and so we can update. So we can update our directory.
Okay. So they're starting to leave. So.
Okay, great. Well, if no one has any other questions, I really thank everyone for joining. We do have another session tomorrow. Sandra, what session are we having tomorrow?
A scheduling setup.
Scheduling setup starting tomorrow at 3 o'clock. So if no one else has any questions, thank you very much. Have a good rest of your afternoon.
Brian, I have a quick question again.
Oh, yes. Okay.
Hi. It looks like the QTech meeting and then standing training tomorrow or at the same time. Is your training going to be recorded as well?
Yes, we plan on also recording tomorrow's training as well.
Okay. All right, wonderful. Well, thank you so much for your time. This was a really good training, very informative.
Awesome, great. Thank you. I appreciate the feedback.
You're welcome. Have a good evening.
You too. Take care. Thank you, everyone.
Thank you.
Thank you.